Hello doctors and friends, we are from SGD 2 and today we're going to present our student project about endophthalmitis. Here's the list of our members. Next, we're going to start with an introduction. The human eye is an important sensory organ with complex structure and function that many things could go wrong. Ocular infection are one of the eye problems, for example endophthalmitis. Endophthalmitis is a purulent inflammation of the intraocular tissue and fluids with many etiological causes. Although endophthalmitis is rare, it can cause poor vision, vision loss, panophthalmitis, and blindness if not diagnosed and treated promptly. Next. This is the problems of the research. This is the objective of the research. Next. This is the benefit of the research. Next.
Endophthalmitis is a type of ocular inflammation due to the infection of the intraocular cavity, which affects the intraocular fluids and tissues and can and may result in a permanent loss of vision in the affected eye. Further categorized by the route of the infection, endophthalmitis can be classified as exogenous and endogenous. Another categorization of endophthalmitis is by the causative organisms, with acute onset postoperative endophthalmitis making up the majority of all reported cases of endophthalmitis. Between endogenous and exogenous endophthalmitis, exogenous endophthalmitis is also found to make up most cases and is a usual occurrence as a complication of cataract surgery or any other penetrating ocular trauma. Endogenous endophthalmitis occurs as a result of the spread of infectious agents from a distant focus infection, while exogenous endophthalmitis is usually caused by infecting organisms that enter the eye via direct inoculation and/or contagious spread from the near tissues.
Endophthalmitis is rare, occurring in only 2 to 15% of all cases of endophthalmitis. Average annual incidence is about 5 per 10,000 hospitalized patients. In unilateral cases, the right eye is twice as likely to become infected as the left eye, probably because of its more proximal location to direct arterial blood flow from the right innominate artery to the right carotid artery. Many medicine societies institution monitors the incidence of cataract surgery-associated endophthalmitis. On the basis of the reports published in ophthalmic literature, the current incidence varies from 0.03% to 0.2% across the world. These rates are much lower than the incidence rate of 0.128% reported between 1962 and 2003. Beginning 2003, a slight increase in incidence was registered, which was attributed to the practice of clear corneal incision, 0.29% compared to 0.05% with scleral corneal incision.
So, various factors that can lead to endophthalmitis are primarily associated with the occurrence of immunosuppression or increased risk factors for blood-related infections. So, various factors most commonly associated with immunosuppressive diseases such as diabetes mellitus, and other risk factors such as HIV infection, cancer, kidney failure recording dialysis, heart disease, long-term use of broad-spectrum antibiotics, steroids, and other immunosuppressive drugs, surgery such as intra-abdominal surgery, intravenous drug abuse. And most commonly reported origin of infection is an abscess in the liver, followed by pneumonia, endocarditis, tissue infection ligaments, urinary tract infections, meningitis, septic arthritis, and orbital cellulitis. Longer stays in hospital and getting more intensive care are also associated with increased risk factors.
For the pathophysiology, the foremost critical factor within the causation of endophthalmitis is the breakdown of the visual blood barrier and intraocular colonization by pathogens such as bacteria and fungi. In exogenous endophthalmitis, the affecting damage or surgery causes disturbance of the globe integrity, which permits attacks of the pathogens. In endogenous endophthalmitis, common source of bacteremia, fungemia, incorporate endocarditis, urinary tract infections, intravenous infusion, inhaling catheters or invasive methods, liver abscess, and others. The acute inflammatory response may clear the less virulent organism. In any case, more virulent organism may affect the host immune response by discharging toxins or biofilm around it, in which case the inflammatory reaction can result in the damage of the intraocular tissues and loss of vision.
Okay, actually, there are a lot of signs and symptoms of endophthalmitis, but the most common clinical signs of endophthalmitis are poor visual acuity, corneal edema, hypopyon, features inflammation, and poor fundus visualization. Although pain is a significant diagnostic sign, it may be absent in up to 25% of cases. Other common presenting features are eyelid swelling, red eye, circumcorneal congestion, photophobia, ocular discharge, fibrinous membranes in the anterior chamber, iris synechia formation, loss of fundal red leaflets, and floaters. Next.
The clinical diagnosis for endophthalmitis often came out with high false negative rate. Therefore, several assessments should be done, such as ocular examinations including reduced visual acuity, conjunctival injection, hypopyon, corneal edema, anterior chamber cells, iritis, and also vitritis. With the key finding of the diagnosis is white infiltrates arising from the choroid. Next are diagnostic tests such as vitreous fluid biopsy by vitrectomy, RT-PCR, and also blood culture to identify the etiology of the infection. And also imaging such as neuroimaging can evaluate for intraocular foreign body or intraorbital and intracranial source of infection.
Imaging evaluations such as neuroimaging can also examine for an intraocular foreign body along with intraorbital or intracranial sources of infection. There are also several differential diagnoses for endophthalmitis such as non-infectious uveitis, infectious chorioretinitis, intraocular foreign body, white dot syndromes, and malignancies such as intraocular lymphoma and retinoblastoma.
Early diagnosis and treatment is very important for a better prognosis. However, patients with endogenous bacterial endophthalmitis may have a delayed diagnosis, which can lead to a poor prognosis and cause complication. In general, endophthalmitis does not have a good prognosis and can result in total vision loss, especially if the diagnosis is missed early and result in treatment delays. Complications of endophthalmitis that can occur include impairment of vision, complete loss of vision, loss of eye architecture, and enucleation. Progression of endophthalmitis can also lead to panophthalmitis, corneal infiltration, perforation, and affection of orbital structures. When the inflammation of endophthalmitis extends to the layer of the eye, such as retina, choroid, sclera, and glass body, it can lead to panophthalmitis. Panophthalmitis is inflammation of the entire eyeball, including the sclera and tenos capsule. If left untreated, endophthalmitis can cause visual disturbance, permanent blindness, and phthisis bulbi.
When infectious endophthalmitis is suspected, vitreous cultures acquired by needle aspirations or vitrectomy are recommended. After blood cultures have been collected, medication should be started as soon as possible. Treatment with intravitreal antibiotics may be required in bacterial endophthalmitis. Vancomycin and ceftazidime are used for gram-positive or gram-negative. Vitrectomy combined with intravitreal injections of amphotericin or voriconazole is used for fungal endophthalmitis. In the treatment of endophthalmitis, pars plana vitrectomy or PPV is a regular procedure. It can be used for both diagnostic and therapeutic purpose since it has the potential to eliminate a huge number of organisms from the vitreal cavity.
To prevent endophthalmitis, there are certain things that we can do. First, use protective eyewear when doing activities around the house that possibly injure our eyes. Example, sharing wood. 2 is wear appropriate eyewear and safety gear during contact sports. 3. After eye surgery or eye injection, follow your doctor's instructions to care for your eye. Example, wash your hand before putting eye drops. When you get cataract surgery, there is a review from Cochrane to establish effect of perioperative antibiotic prophylaxis for endophthalmitis, such as cefuroxime, that can lower the chance of endophthalmitis.
So in conclusion, endophthalmitis is an ocular inflammation caused by an infection of the intraocular cavity that affects the intraocular fluids and tissue. Endophthalmitis can be classified into exogenous and endogenous endophthalmitis. The epidemiology of this type of eye infection is rare, with the annual incidence of 5 out of 10,000 hospitalized patients. In unilateral cases, the right eye is twice more likely to be infected than the left eye. The risk factors of endophthalmitis is primarily associated with immunosuppression, most commonly diabetes mellitus. Other risk factors are HIV infection, cancer, kidney failure requiring dialysis, heart disease, long-term use of broad-spectrum antibiotics, steroids, and other immunosuppressive drugs, surgery such as intra-abdominal surgery, intravenous drug abuse, and longer stays in hospitals. The pathophysiology of this disease is that a critical factor that causes endophthalmitis is the breakdown of the visual blood barrier and intraocular colonization by pathogens. The common symptoms of endophthalmitis are poor visual acuity, corneal edema, hypopyon, vitreous inflammation, and poor fundus visualization. In endophthalmitis vitrectomy study, decreased vision and pain occurred for 94% and 74% of all symptoms respectively. Pain may also be a sign of endophthalmitis, but it is found absent in 25% cases. The clinical diagnosis for the endophthalmitis is hard to achieve due to its high false negative rate. Therefore, thorough examination is required. Endophthalmitis can be diagnosed through ocular examination and diagnostic tests such as vitreous fluid biopsy, RT-PCR, and blood culture.
So now I'm going to continue about the conclusions. The late diagnosis of this disease may lead to poor prognosis and can lead to complications such as impairment of vision, complete loss of vision, loss of eye architecture, enucleation, panophthalmitis, corneal infiltration, perforation, and affections of orbital structures. The treatment for endophthalmitis itself varies through its etiology. Drugs that's commonly used such as vancomycin, ceftazidime, amikacin, fourth generation of fluoroquinolones, has been found effective to certain pathogens that cause endophthalmitis. Vitrectomy combined with intravitreal injections of amphotericin or fluoroconazole and systemic antifungal medication seems to be the best treatment for severe fungal endophthalmitis. For the prevention itself, endophthalmitis can be prevented by wearing protective eyewear when doing activity that can injure our eyes and during sports. That's all from us. Thank you for your attention and have a nice day.